A new study shows a person's lifetime cancer risk might be established before they're even born. Scientists, they're sharing the results of a study using mice. Researchers actually found two distinct genetic states that arise during the fetal development that are linked to a person's cancer risk. One increased cancer risk, the other reduced it. However, not every abnormal cell goes on to become cancer. We need someone to break this down for us. So look who's here. It's Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doctor, great to see you. I thought the study was fascinating. What's your takeaway?
I think these studies are fascinating. So, cancer is a big deal, second leading cause of death in the United States. And what we're trying to understand as a medical profession is, who's going to get cancer and who's not going to get cancer. And there's the environment part of this. So we try to understand, diet, and things that you're doing in your environment, exposures that can lead you to an increased risk of cancer. And then we're understanding about how you're made, your genes. And this study, looking at mice, not humans, looks at this TRIM28 gene. And we know that this gene does regulation. So when cells are doing things they shouldn't do, i.e. cancer cells growing out of control, it can regulate that or slow that down. And by day 10 of conception for these mice, they see this split in how this gene is expressed. And on one side of it, you have a higher risk for cancer. And if you get cancer, you have these more dangerous solid tumor cancers, like breast cancer. And if you get the more favorable expression, you have a lower risk for cancer. And if you do get cancer, you get more less solid states, so more like your lymphomas and leukemias and things like that. So what this means is if this pans out, we could target looking for this gene or this expression in people and then monitoring them more closely over their lifetime because we know that they might be at a higher risk of developing cancer.
I think all this genetic testing is fascinating. I actually had genetic testing when my wife was pregnant, and I thought it was really interesting. It wasn't even considered in my life until really I had a baby on the way. I mean, do you think in the future there could be a day when maybe it's routine where we just do genetic testing on ourselves when we're born?
Yeah, I mean, even right now, there are some genetic tests that are done, but I think there is a wide berth of opportunity around understanding what you're at risk for before you're born. And then we can modify, the lives that we live knowing what risks we have.
Right. Or in this case, if I know I'm at a higher risk for cancer, maybe I do things differently throughout my lifetime. It is so fascinating. We'll see what comes to that. Okay. This caught all of our eyes in the newsroom because there may be a new reason to floss your teeth. And it doesn't have to do with bad breath. It actually might save your life, although it has something to do with bad breath too. But this is completely different.
Yeah, this is a really interesting study, and I don't even know how this is working, but they followed about 6,000 people for 25 years, and they looked at all things flossing. And sure enough, if you floss, and not even that often, once a month or once a week, your risk for a stroke that starts from a clot from your heart to your brain decreased 44%. Your risk of developing atrial fibrillation, that abnormal heart rhythm, decreased 12%. Now, we don't know why. The researchers say, hey, inflammation in your mouth, if you don't have good dental hygiene, can lead to inflammation in your arteries. Maybe that's it. I think there is probably something about people who are flossing all the time. They're probably doing other things all the time that is reducing their risk for stroke and atrial fibrillation. But what an interesting association between flossing and strokes or atrial fibrillation.
I'm going to pick up my flossing, I'll tell you that much. You know what I really hate? When you go and the dental hygienist says, your mouth is open, and she goes, do you floss often? I'm like, you already know the answer. Like, you're staring at my mouth, you know that.
You're shaming me.
It's like, you're a doctor. It's like when you ask people if they smoke or not. Like, you know, come on, you know,
I know,
right?
like I can already smell it, but
right.
it's just kind of like.
Look at
See?
me. Yes.
Dr. Pothof telling us. Okay, we only have a few seconds here, but tell us about this FDA approval of a painkiller that's not an opioid.
Yeah, this is Jurnivax, and what's interesting about this, it's kind of first of its kind. So it blocks sodium channels, which then block pain, acute pain, that sensation from getting to your brain. Now, it's not a miracle drug. It works just about as well as a low-dose opiate. I think what's cool about this is that it works differently than our normal meds, opiates, or even non-steroidal anti-inflammatory drugs. Unfortunately, when these things first hit the market, they're extraordinarily expensive, and Tylenol and ibuprofen are pretty cheap. So I don't see we're going to see a lot of use. But in folks that can't take those medications and whom are trying to avoid opiates, this could be a promising pathway for them.
Possibly a game changer. Dr. Pothof, a man who is always honest with us. I appreciate your time.
Thank you so much.